Moderator, I'm thinking that before you start, you can announce to the guests about the posting their questions on the Q&A section.
Okay.
Yes, and checking if the answers have been provided, because sometimes we will answer there and then. And also to mute their microphones.
Yes.
And their videos to transmission.
Okay.
The etiquette of
yes.
Zoom or these virtual meetings.
Yes, all right. Yes, I'll ask them to mute and put their videos off. And then can we also ask them on the chats to indicate where they are logging in from?
Yeah, that one can be done.
Okay.
Okay. Thank you.
Thank you, Chair. We are now live.
Rashid, we are on now.
Yes, we are live now.
Okay, thank you so much. So, good evening, our esteemed guests. We are happy to have you with us this evening, and we warmly welcome you to the 6th Nurse Midwife-led webinar, the 2021 series. These webinars are organized to offer a platform for nurses and healthcare workers to share experiences and learn from one another as part of the strategy to support the well-being and resilience of the nursing workforce and post-COVID-19 pandemic. We realize that this is a very stressful time, especially for the frontline health workers. These webinars are organized by the nurse and midwife educators together with professional associations of Kenya, specifically Mr. Michael Nyongesa, who is the chair of KPNA, Mr. Obengo, who is the president of NNAK. NNAK is the host, and together with Mr. Obengo, we have Jacinta and Moses Chirchir. We have Jemima, we have Rashid, Teddy. Jemima, Rashid, and Teddy are behind this technological support. So I want to thank them for this. And we have the 4 schools of nursing in Kenya. We have Moi, represented by Dr. Dina Chelangat, who is the Dean of Nursing. We have JKUET, simply called, represented by Dr. Albanos Mutisia, who is the Dean. We have MKU, represented by Madam Ruth Mbugwa, who is the head of Community Health Nursing Department. Then we have University of Nairobi faculty. We start with Dr. Irene Mageto, who is the coordinator of e-learning, Dr. Jabet, the head of midwifery and obstetrics nursing. We have Dr. Eunice Omo, who is the deputy head of postgraduate studies at the school, and myself, Miriam Wagoro, who is currently the director of the School of Nursing. And this 2021 series are supported by the Bardet Trust for Nursing in the UK. We intend to document nursing experiences through a book which we can read and help us to refer in future. And we want to thank you for the support you have been giving us by joining our webinars right from May last year. We do not take that for granted. And our topic this evening is a very important topic, nursing leadership and management at this particular time during COVID-19 pandemic is full of challenges. There's need to have resources. There's need to ensure the staff are getting mental health care and physical care as well. So then we want to look at nursing leadership and management during COVID-19 pandemic. We want to look at the experiences, resource mobilization, and other challenges. To speak to us on this topic are our eminent speakers, whom we are proud to introduce to you. Madam Halima is a household name in nursing. She is the Director of Nursing Services of Machakos County. We have also Madam Margaret Mungui. Madam Margaret Mungui is a very senior nurse. She is the Deputy Director Nursing at Moi Training and Referral Hospital. We know that is the second largest national hospital in Kenya. And we have our able moderator from Nairobi Hospital, and her name is Madam Margaret Sirma. Margaret Sirma is the Director of Strategy and Innovations at the Nairobi Hospital. Margaret Sirma is one of us in the profession. So we want to welcome them all to lead this session. And now it's my pleasure to hand over the session for administration to Madam Margaret. Margaret, over to you now.
Thank you very much, Dr. Wagoro, and thank you all for joining in for this session. I do feel most welcome. Before we start, I will request Rashid to put up the poll. Rashid, if you could put up the poll. And as he puts up the poll, I'll request you to respond. It's right there on the screen. Please do respond, and he's going to give us a tally shortly after this. And as you get to making your responses on that poll, I would like to do a little housekeeping. I would like to request all of us to keep our mics muted at all times. Also keep your video off at this time as well throughout the sessions, unless we would really want you to put it on. I will also request you that on the chat, on the question and answer docket, that you could put down questions as we go along, any question that you'd want to put down there. It is also important that you also keep checking on the responses, because we also intend that as you ask the questions, we shall also be responding to them on the same chat. Please do read and get your responses there. We may not have adequate time towards the end to be able to respond to all the questions. It would also be good for you to let us know where you're logging in from. So please do indicate whether you're logging in, from different parts of the country or even from outside of the country. That will be important for us to know. So once again, do feel most welcome, and thank you, the organizing team, for continuously organizing these sessions. Indeed, they have been very, very educative in this season. COVID has presented to us, new ways of doing things, and definitely we are at a better place in terms of technology. So thank you very much. And of course, well, with COVID, even as our topic reads today, that every nurse is called to be a leader, and that was really our theme last year, of making training nurses to be leaders. And so with leadership in COVID, I'm sure each one of us has had a different role to play, whether you are in service delivery, whether you're leading a team, in the ward, or whether you're leading a team or a hospital, or just leading your colleagues, you really are you are a leader. And therefore, do feel that this is part of what this is relevant to you, and that your contributions towards management of COVID are appreciated, first by institutions, and more important, by the patients and the relatives that we serve each and every day. So do feel really welcome. We have very able presenters this tonight. And thank you, Rashid. There goes our tally. Thank you very much. I know this will also be present for us to be able to just experience and to interact with that. Have you taken COVID vaccine? 84% have, 16% haven't. We hope that you will have another opportunity when the vaccines are available. What would you recommend nurse leaders to focus more on during the pandemic? Safety at work, 82%, staff motivation, 74%, remuneration, 32%. This is awesome. I mean, what really people want to focus on: service delivery, 47%, workforce, 53%, and then information systems, 47%, financing, 31%, policy, 21%, research and technology, 40%. Amazing to just see what it is that we really want to focus on. Once again, thank you all of us for being part of this. And at this point, I would like to invite our first facilitator, that is Madam Halima, and she has already been introduced, Director Nursing Services, Machakos County. Welcome, Madam Halima.
Madam Halima needs to unmute.
Sorry for that. Good evening, viewers. My name is Halima Adan. Thank you, Madam Sirma, for inviting me on, and thank you to the organizers of this webinar and to NNK and KPNA. I'm going to do my presentation. So I work at Machakos County Referral Hospital. That is the Machakos County Referral Hospital. I'm the Director of Nursing in the county, so my office is located in that building. And the topic is on leadership and management during the COVID-19 pandemic. I'll start us off with the Constitution of Kenya, Article 43(1), where it says every person has the right to have the highest attainable standard of health, which includes the right to healthcare services, including reproductive health. Our governor's manifesto, Dr. Alfred Mutua, is providing accessible, affordable, and efficient healthcare to all. And our county, Machakos, has been one of the counties that has implemented free health services through UHC. And we are still, despite the challenges, able to offer the free services through UHC. So we have the WHO building blocks, that is, as you can see on the screen: leadership and governance, healthcare financing, service delivery, health workforce, medical products and technologies, health information systems. And during the COVID-19 pandemic, we were able to interact with all these building blocks, but I'll just focus on about 3 of them as we move on. So 2020 was supposed to be the year of the nurse, and the theme was to lead, innovate, and excel. So we thought it was a year we were to celebrate and all that, but we celebrated it in other ways when COVID-19 landed. So the workforce in the county, we have a total of 1,349. In my office, I have about 10 nurses who had different units and services within the county. We have 1 county referral hospital with 395 nurses, 10 level 4 facilities out of 6 which were gazetted last year, and it has about 301 nurses, 34 level 3 facilities with 329 nurses distributed. We have some facilities with about 20 nurses and others as low as 6, depending on the workload and the location of the facility. And our level 2 facilities, which are 143 with 314 nurses. I would proudly say that about 900 nurses out of the total workforce have been employed after devolution. So we are a county that would boast of success stories in terms of additional additional healthcare workers and especially nurses during this time. So it's still work on progress, but we are somewhere. So the proximity of Machakos to Nairobi is about 60 kilometers. So when COVID is a menace in Nairobi County, we are affected directly. So this is a photo of the first case of COVID-19 in Kenya, a gentleman who was even announced by His Excellency, the President of the Republic of Kenya. And if you can see me at the corner there trying to tie my colleague, Director Ndusi, we were to go in and show our healthcare workers that it was okay to nurse the COVID patients because there was a lot of fear. But we were so many of us, the team was very aggressive and enthusiastic to support the patients. So that was our first case. And what we did when we started, we formed a county multi-agency COVID response team under the leadership of our governor. We started training for the rapid response teams at the county level and sub-county level. As we moved on, our lab was certified for PCR testing, and this has really helped us in managing our patients. We moved from 0 beds in we didn't have any isolation center, but currently we boast over 400 isolation beds across the county. We also managed to do an isolation ICU for Machakos level 5, which is a 10-bed ICU. We are currently doing a Kangundo 6-bed ICU, which is at 80% completion, and we hope to launch it in probably another 1 or 2 months. And on the pipeline is Mwala level 4 hospital, which will have a 4-bed isolation. Infrastructure-wise, we also had a 240-bed field hospital, and we did renovations for a few isolation wards in the county. In terms of human resource, there were new staff recruitment that was MOH supported through UHC, and we did staff redeployment depending on the workload and the new units that were coming up. On the financing part, we received a World Bank grant through MOH that really assisted us to buy equipment, lab reagents, and even give our healthcare workers a token, but we still owe the healthcare workers who are working in the isolation wards a token that was promised, and we are working towards giving it to them probably in our next financial year that is starting in July. And then the county government of Machakos also, you remember it was the first county that gave a COVID-19 allowance, which followed countrywide, that was given by His Excellency, the President of the Republic. Health commodities, we got them from MEDS, KEMSA, and even local suppliers, and we had some partners who were giving us donations, partners like AMREF and UNICEF. So that is the field hospital where we started. And as we moved on, if you look at the carpet, it was having some breakages, and we were visited by a team, the IPC team from Afia House, and they advised us to get a floor that was continuous, that was easy to clean. So as you see, you can see where we started and the journey as we moved on. And our governor has been very supportive. He always came to visit the sites. So this where we are having the caps on our heads, we were at MEDS to buy equipment during the same time. So consultations here and there, drip stand, a lot of preparations. Then as we moved on, as you can see the floor right there, we did a PVC floor that was easy to clean. We made sure that our patients had the duvets that were very warm. Actually, we had purchased heaters, and our patients never use the heaters currently because the duvets are warm enough. They have duvet covers and they are warm enough to take care of our patients in the field hospital. So our challenges, there were a lot of apprehension, hesitancy, and stigma within the communities, within the health workforce, even within ourselves as management. So also we were lacking training resources. Sometimes we'd even move with our own vehicles fueled by ourselves to go and train and support our teams. Commodities and supplies, there were issues here and there on the PPE supply and quality, and the need for the PPEs also was quite high. So once in a while, we would miss out on supplies, but the attitude and the zeal from the management team was always to continuously supply and protect our healthcare workers by supplying proper and adequate PPE. We also have issues around oxygen, despite having 2 oxygen plants and manifolds in our casualty unit. We have realized that that is not enough, and there's a conversation going on towards ensuring that we get a bigger oxygen plant. And we also have a partnership through MOH and KEMSA. They are going to do an oxygen plant for Kangundo Hospital and a manifold for our transition ward at the Machakos County Referral Hospital. ICU beds and equipment, I would say, despite the initial challenges, we are currently having 25 ICU beds and ventilators and equipment around that. So at least that's a positive despite the earlier challenges. On staff morbidity and mortality, we've had quite a number of staff getting infected, and majority of them are nurses. We have always supported them through home visits and monitoring and giving them enough time to rest and recuperate and recover. And so far, we've only had 3 mortalities, 2 nurses and 1 doctor, and only one of the staff was working in the isolation ward. In terms of staff welfare, we have made sure they have flexible duties. They always work for 6 weeks and they get 2 weeks break to re-energize and come back. We also promised them a token, and I'm sure they are listening. Your token is still on the pipeline, the budget is ready, the list is ready, and you're going to be motivated. On testing, we have continuously tested our staff and the patients that come to us, because we have a lab that is testing, and that, despite the challenges and the expense and giving out free health services to the residents of Machakos, I want to appreciate the management, our chief officers and the CEC and the Department of Finance through His Excellency Dr. Alfred Mutua and his deputy for making sure that we are a priority, and despite challenges of finances, they have continuously supported us. So psychosocial support, we partnered with the Nursing Council. We had Zumba sessions for our staff, quite a number of them. We managed to visit a few sub-counties for the same, and we are planning to do that. We were supported by AMREF on the same, and there was also the support, the call center that is being done by NNK and KMA and other organizations that is really helping us, and our staff are reaching out. We also have psychosocial support groups on the same. So vaccination, as you can see there, my governor behind there, urging us to take up the vaccine. I was among the first people who received the vaccine, and the turn up was great, and we hope that we still get more, because we have run out of the vaccines. We hope that the government provides more doses and everyone is vaccinated. So that's a slide on our partners, UNICEF, Kenya Red Cross, the Vic Steel Mills, they are giving us oxygen. Tononoka has come in again to give us oxygen. Equity Foundation through NNK, KMA, they have really come out strongly to give us PPEs. AMREF Kenya is supporting us on online COVID trainings and other trainings. KMPDU through Safaricom also gave us PPEs, and we appreciate them. In a nutshell, teamwork works. This is a duration where in this country, healthcare workers saw the need of coming together and supporting each other, and we have faced the pandemic all the year long. And I want to appreciate all the healthcare workers, all the nurses in Machakos County for facing this pandemic with zeal and with strength. And I'm sure God is going to bless each and every one of us. Thank you so much for the opportunity. And I'll be looking forward to the questions if there are any, and I'll be able to answer. Asanteni sana, Mungu awabariki.
Thank you so much, Madam Halima. God bless you too. I'm sure wherever you are seated, let us really give a hand of a clap in appreciation of that presentation. Very motivating, exceptional, indeed demonstrating teamwork and partnership. Thank you very much. Please have questions in the chat section, in the question and answer session for Madam Halima. But at this point, I want to invite Madam Margaret. Madam Margaret is a Deputy Director, Nursing Services from MTRH. Welcome, Madam. Madam Margaret, you can unmute.
Thank you.
And as she shares her presentation, I would like to remind you, please put down some questions on the chat section, on the question and answer section. We shall be responding to them.
Thank you very much. I hope you can see my screen.
Yes, we can. You can maximize.
Thank you very much. My name is Margaret Mungai. I'm working at Moi Teaching and Referral Hospital. This is the second largest hospital in our country. And the hospital, this is the main entrance of our hospital. We have various centers of excellence in the hospital. This is one of the small hospitals in our hospital. That is the MTRH True for Africa Pediatric Hospital.
Margaret, maybe if you could put up the slides, start from the beginning so that we can see the entrance. Thank you. You can go to the first slide.
That is the first slide about the topic, but the entrance of the hospital this is the main entrance of the hospital. Of course, it has other entrances, but this is our main entrance. And this is another hospital in the hospital. This is called the MTRH True for Africa Pediatric Hospital. So this is a pediatric hospital. We also have other centers, like even the Raili Mother and Baby Hospital. In short, what I'm trying to say is that our hospital is really scattered in many centers of excellence, and that is how the hospital operates.
Sorry, Margaret,
yes?
Click the first slide. Click the first slide. Is it appearing maximized on your side?
Yes, please.
Maybe you can minimize first. Minimize and go to the first slide.
Or scroll up.
Sorry for that, but this is the beginning of the presentation. I don't know whether you are seeing this. It is only the topic and the presenter.
Not yet
No.
there.
On our screen, you are on slide number 3. On the screen that is projected, you're on slide number 3.
Actually 5. Actually slide number 5.
Yeah, slide number 5. Thank you.
So let me end the show again, or I go to the previous. Sorry, let me just go. Am I there now?
Not yet.
Could you double click on the slide, please?
Okay, excellent. Yes, now you're on the first slide. Can you go to slideshow?
Is that okay now?
You're not still on slideshow. Can you go down there to the either down to the icon or go to the top icons there? You see slideshow up there? All right. You know what, Margaret? Colleagues,
yes,
because
please.
So that we save on time, I think we can go ahead since we can visualize. Can we all see? I'm sure we can all see. So Margaret, go ahead.
Okay, thank you. I'm sorry for that. So this is the entrance to Moi Teaching and Referral Hospital. That is the main entrance. We have other hospitals within the whole campus, and this is one of them, the Shoe for Africa Pediatric Hospital. I was saying we have other hospitals like the Riley Mother and Baby Hospital, but I've not shown it here. Straight to the presentation is that upon the preparation for COVID management, the MTRH nurse leaders were incorporated into the MTRH COVID-19 Control and Suppression Committee. It had various subcommittees, that is the Communication and Coordination, the Nursing and Infrastructure Subcommittee, Treatment and Care, Surveillance and Contact Tracing, and Home-Based Care Committee.
Okay, Margaret, if you could scroll down your slides.
Yes.
Your slides are not running down, so go down your slides. We are still at the very first slide where there is leadership, nursing leadership, and your name. We cannot visualize on a slideshow the hospital. So if you could scroll down.
Okay, let me close it and start again because it is scrolling down on my laptop here. Let me just close it first, and I'm really sorry for this. Is it okay now?
We still can't, okay, we can see the slides, but maximize.
I think that is
good, Margaret. We are there now. Thank you.
Yeah. Okay. So that is the entrance to Moi Teaching and Referral Hospital. That is the Shoe for Africa Pediatric Hospital. And straight to the presentation. I hope you are all there on the background.
Yes, we are, Margaret. Thank you.
So the nurse leaders at MTRH were incorporated into the MTRH COVID-19 Control and Suppression Committee and its subcommittees, which was 5 of them: Communication and Coordination, Nursing Infrastructure, Treatment and Care, Surveillance and Contact Tracing, and the Home-Based Care Subcommittee. The role was clearly cut for them, and it was basically about prevention, treatment, and vaccination against COVID-19. The nurse leaders were supposed to guide in the interpretation, adapting COVID-19 national guidelines, including the frequent communique that used to come for implementation. They championed in the sensitization of all employees in the hospital and also identified, outlined, and communicated plan of action upon receiving any suspected patients. For sure, this was an acid test for the nurse leaders and managers at Moi Teaching and Referral Hospital. We had many experiences, and our first case was on 9th April 2020. This is a lady who tested positive after having been tested on 6th April 2020. And the nurse leaders had to really harness teamwork within the interdisciplinary healthcare teams for achievement of whatever we wanted to do about the COVID-19 preparation and actually care of the patient. And also listen, empathize, and respect feelings of uncertainty and fear among nurses. Yet, as the leaders, we had to do a lot to empower nurses as they took care of the patients. We also had to cope with the new and evolving guidelines, protocols, and updates, more so towards the new PPEs, the new equipment, because as we started taking care of COVID-19 patients, some of the nurses had not even seen the PPEs. So the sensitization included even demonstration on how to wear them and even remove them. There was a lot of learning that was going on, so the leaders had to make sure that the nurses understood the issues of the disease about prevention, care, and we had a lot of first-hand experience from the healthcare team members and the patients, because we even had to let the patient explain to us how they were feeling now that this was a new disease. The team actually envisioned our capabilities at Moi Teaching and Referral Hospital. Therefore, we focused on testing eligible patients and clients only. We didn't at any point test walk-in patients, and this is because we knew the testing kits and the transportation media were not so much available. There was continuous sensitization on strict adherence to the COVID-19 prevention protocols. And actually in the hospital, we didn't have to accommodate our nurses or isolate them away from their houses, because with the proper adherence to the protocols, they were safe for themselves and for their families. We had to garner a lot of courage and optimism as nurse leaders so as to support our nursing teams. This is because among them, we have nurses with a lot of comorbidities. Some are elderly. However, we needed a lot of nursing workforce despite some of them getting sick and being away from the institution. We embarked on communication, portraying gratitude and support to the nurses, and more so we focused on the mental health aspect of the staff, the patients, and the relatives. We offered psychological support and debriefing to the nursing teams to enable coping with infections, mortality, and this one is including the patients and even the colleagues. So it was really difficult for them, and we had a lot of debriefing sessions. The need for prompt response and decision-making upon any consultation or inquiries. This is because they needed the support, the information, the decisions made there and then. The hospital also did a hotline and a cell phone number for the public to call in. This is because we realized the referral coordinator line was really getting jammed with a lot of questions and concerns, to ensure that everybody who had a concern from all over the region would get some feedback. There was even a self-screening tool that we advised them to take before they come to the hospital. This is one of the multidisciplinary rounds that we usually do, and this is done every week, one day in a week. The CEO and the rest of the senior members of the institution engage the staff. At that point, they bring out their concerns, their fears, and the decisions can be made there and then. The working hours and duty reorganization was done. This is because more so at the time of the curfew, we had to readjust the night duty from 5 p.m. to 7 a.m. Confidentiality was required, and we really tried to ensure that the COVID-19 results were available for immediate action. Initially, I remember we would task some few people to go around the wards, conveying the results both to the patients and the staff. However, as the cases increased, then this one was actually integrated to more people. However, we ensured confidentiality of the results. It is at this time we realized that the nursing voice is really needed in areas of infection prevention and control, in the care provision, knowledge dissemination, guidance, care provision and support for the healthcare providers and the rest of the multidisciplinary team. There was scaling down of the consultants' clinics and extended the drug refills for the patients so that they can be away from the hospital. We learned that contact tracing was very effective in the early stages, but the moment we reached the level 4 community transmission, then it was not feasible to continue the contact tracing. There were a lot of logistics and scheduling of vaccination for the MTRH staff and the collaborating institutions, where we ensured that including the students and the registrars who are in the institution were vaccinated to ensure safety. As far as resource mobilization is concerned, we did a lot of reassignment, redeployment of nurses so that they are able to cover the inpatient area, the evaluation and testing center, and even do home-based care and follow-up. In the beginning, we used to do outreach services and even embarked on testing the truck drivers away from our region. As far as infrastructure is concerned, we have a Rafiki Isolation Center. This is an inpatient care. There is also the Rafiki Evaluation Center. This is a walk-in where you come for testing after you have been screened and identified to be eligible. There is a Mani isolation ward. This is also another inpatient ward. And also we have a laboratory where the testing is done. Oxygen generation plant, a new one was started, though it's not yet complete, but we had another one before. There was oxygen piping, which was done to ensure that oxygen was available for our patient. In the COVID Aman isolation ward, this is the nurses donning the level 3 PPEs, guided by the donning prefect, and there is a donning area, and then the nurse station is away from the ward. It is actually in the green zone where the nurses rest in between the going in to take care of the patient. There's a separate entrance and exit, and there's a doffing area where there is even a shower amenities where patients go through before they come back to the nurse station to ensure safety. We had a lot of collaborations with the Kenya COVID-19 Fund Board, with Equity Foundation, Indiana University, USAID, Ministry of Health, World Bank, Guangdong from the People's Republic of China, the Smile Train, IPAS, EABL, Brightex International Limited, and this is some PPEs that were given by Equity Foundation. The hospital also employed 114 nurses to ensure that we have enough nurses. Other healthcare products and technologies were instituted, that is the high flow nasal cannula, and even the positive air pressure and invasive ventilation masks to ensure that all COVID-19 patients requiring ICU are ventilated. There was telehealth, teleconferencing infrastructure instituted so that the virtual meetings could be embarked on. Transportation logistics were enhanced. There was also the maintenance of the non-COVID-19 essential health services. At some point, we realized that after we reduced the bookings, we were getting very sick patients, so we had to readjust and continue seeing the patients. We had a lot of county engagement and support, and mainly this was to reduce movement or referral of COVID-19 patients. This is because they should be taken care of at the places they have been identified to reduce transmission. Similarly, the private hospitals were engaged because at first we realized that any patient who tested positive for COVID would be put in an ambulance and they all head to Moi Teaching and Referral Hospital. So to make sure that we are not overwhelmed, we would go and support them in concerning information and how to take care of the patients in their institutions. We had a lot of challenges and we were working on them as we go ahead. And the first one was regulation of visitors, whereby our people are used to visiting our patients in the hospital during the visiting hours. So the moment we stopped this, the relatives would come and hang around the hospital, and it was really difficult to make sure that they are not in the hospital. Inadequate resources, financial constraints, and this is towards the PPs. Despite all the collaboration and the support we had, they can never be enough. There was increased workload, yet some patients perceived a dehumanized, discriminatory care in isolation ward. And as we engaged with them, they would say that the nurses are coming weird, that we don't even know who they are. We may not even tell whether they are male or female. So it was really difficult for all the nurses and even the patients themselves. Burnout and exhaustion could not be underestimated with the long working hours. However, the hospital embarked on compensatory offs and giving food and teas for all the staff taking care of the patients, a lot of debriefs and duties with resting periods, whereby once a nurse dons and goes into the isolation ward, after 4 hours, they're supposed to come out and then another team would go in for them to be able to rest. There was a turmoil on psychological effect of COVID-19 for patients and relatives, and this one required continuous debriefing for both patients, relatives, and the staff. At some point, there are some staff who reported that their family members would say that they don't want to stay with them because of being afraid they might be infected. But as time went on, we would engage them and talk to them. And currently, we do not have such issues arising anymore. The stigma was there, and this is more so at the initial stages. even within colleagues who are working in the same unit. For example, if they know you're working in that ward, they would avoid you. Even those ones who got sick, when they come back, there used to be a problem of integration. And this is how the hospital worked on an MTRH integration policy that stipulates how the patient, the staff would be welcomed back. And this is championed by the HR department of the institution. During the industrial action within the county facilities by the doctors, nurses, and clinical officers, we were getting a lot of referrals to the institution. And then there are patients who deny the positive results and they present blindly to other facilities or get lost to follow up on home-based care, which would pose a lot of challenge to us, and the team would really try to find out where they are and call them. Then it was reported by some of our patients that COVID-19 is actually the loneliest disease they have ever come across. And I think it can be understood because of the isolation, the PPEs, no visitors around. And it's at this point when we realized some of our patients were not getting well at all and they were asking for their relatives, others even kindly requesting, I don't want to die alone. The hospital introduced a COVID-19 care companion for the very sick patients. This is whereby on admission or when the patient becomes quite sick while in the ward, they would be asked, whom do you want to come and take care of you? And then the people would be invited. They would be taken through psychological counseling and explaining that it is a risk to be there. However, we have the masks, which they can take care of the patient with those masks. And this has been accepted very well within the community. And it could be the son or the daughter or even a spouse. They are actually allowed to stay with their very sick patient inside the isolation ward. The other challenge that we continually recognize is the issue of public political sheer disregard of safety protocols, which actually is something that should be addressed, and we wish everybody would follow the protocol. The issue of infodemics and miscommunication was real, especially in the initial stages, where patients or even relatives would call in to ask about some information they have gotten. However, it didn't have any basis. So the team used to have a lot of work talking to them, explaining to them, and guiding them that it's only the Ministry of Health that should be giving the right information in their correct channels. In conclusion, I really wish to salute the nursing fraternity at Moi Teaching and Referral Hospital, starting with the nurse leaders and managers, because they have shown great moral responsibility and support to all the nurses who are almost 1,000 in the institution, to ensure that they take care of the COVID-19 patients and the other patients. I also salute the nurses themselves. They have been selfless in COVID-19 care provision and professional mentorship of the nursing students and young nurses. This is because despite we don't allow the nursing students to go to the isolation ward, they are taking care of the patients in the ward, and some of the patients get tested and they become positive while they have been taken care of by the nursing students. So for us, we take this as a learning experience, and we tell them that any patient should be treated as a COVID-19 patient until proved otherwise. Lastly, I wish to salute the MTRH CEO, that is Dr. Wilson Narwasa, for his leadership and support to MTRH nurses. He's actually a friend of the nurses at MTRH, and also our Director Nursing Services, Titus Tarus. He's the leader of the nurse leader managers at Moi Teaching and Referral Hospital. Thank you very much, and I really appreciate that you had me on this presentation. Thank you.
Thank you very much, Madam Margaret. Let's appreciate Madam Margaret from wherever you are, the club. That was really an exceptional presentation. Many things learned. Two things that I would take home is that CEO, senior leadership engagement with staff to motivate them and to encourage them. That is really good. Learning points from some of us, and then also the COVID-19 companion, really a new experience that I am hearing now and learning. And also what is very intriguing, colleagues, is that the challenges and experiences are similar, whether we are experiencing, whether it is in MTRH, Nairobi, or even in Machakos. Asanteni sana. Before we go to the question and answer session, I want to appreciate that we have been about 179 people logged in from across the country. And I would also want to recognize some of our mentors in this profession. I have seen our commissioner, Dr. Maalim, has logged on. Thank you very much for coming and always been a mentor. And a few others that I'll probably recognize as we go on. Allow me, ladies and gentlemen, to go to the questions. A number of questions here, and we have about 10 minutes or less to do that. And therefore, we'll pick just a few. Let me go to Margaret. Margaret, how have you managed the use of PPEs during the multidisciplinary ward rounds? Margaret, to you.
Thank you very much for that question. What we do during the ward round, we have the disposable gowns. It is actually like a disposable lab coat. At the same time, you can have your normal lab coat. This is because these are rounds that we are going all over the wards. So for the multidisciplinary team rounds, as you have seen on that picture, it is actually the disposable gowns or an individual's lab coat. And of course, a surgical mask for each and every person, whether you are you are a healthcare person or otherwise. Thank you.
Thank you, Margaret. Before I go to Madam Halima for a question, I would like to read some few comments which are on this question and answer session. Excellent insight. That is from Fred. Insight from our panelists, Mrs. Mungai and Halima. Indeed, your institutions are transforming healthcare. We hope other hospitals have learned from this session. Kudos, and that is true. We do hope that we are all learning from this great presentation. Let me also mention here that the care companionship is absolute empathy, and I want to echo that. So, Madam Halima, a question to you. Considering the psychological challenges to nurses and healthcare professionals, have you considered doing regular counseling sessions or such methods for nurses to manage burnout, compassion fatigue? You do a wonderful job, and I wish you continuous best. Madam Halima?
Thank you very much, Madam. Yes, thank you very much, Madam Margaret. Yes, we do. We have a team of psychologists and counselors who do that regularly for our staff. But I've learned a lot from my colleague from MTRH, and we are going to incorporate that and ensure that we put them on a rota so that they can continuously do it. So I appreciate the input. Thank you.
Right. I think there's a, thank you, Madam Halima. There's one response here. No, I think it's a question from Fred. MOH is on record that we might use another brand other than AstraZeneca vaccine that was used during the first dose. What have nurse leaders and managers done to ensure that nurses are safe for the second dose? I think that goes to Margaret, but I think I can also open it up to, yes, let's first hear it from Margaret.
Thank you very much for that question. What I can say is that the doses that we received at Moi Teaching and Referral Hospital were 6,000. We have administered all the doses. We are looking forward to in May. However, all of us, we are aware of what is unfolding on the ground. And as an institution, we are ready for any vaccine that will be availed by the government. Because we know with a vaccine, you are at a chance of not getting a very complicated disease or serious disease. Therefore, any vaccine that the government will avail will be welcomed and used for vaccination in the institution. Thank you.
Okay, thank you, Margaret. Thank you very much, Margaret. Madam Margaret, before I hand over to Rashid, I would like to just read one or two comments again on the chat that says, thank you, Madam Halima and Mrs. Mungai for your presentation. Machakos has been on the forefront on excellent healthcare and also MTRH by going by what we have seen in this presentation. What was the role of Care Champion and what PPE did they use and how long did they stay in the hospital? I think that is to Margaret. Madam Margaret, do you like to take that question, which is in the chat?
Thank you very much for that question. What I can say is that the COVID-19 care companion is actually either a relative or a friend. It's like a caretaker of the patient. And this is, the patient might say, I want my son, or I want my wife, or I want this and this, a friend of mine to come. When they come, they are informed about the issue of the disease and how they're supposed to use the surgical mask while they're inside. However, they are also supposed to ensure they follow the safety protocols, like the issue of hand washing, making sure that they have their mask on all the time. And I would also want to mention that they would stay with the patient for the long time the patient would be in that ward. The other thing is that we explain to them that the moment you agree to be the companion of the patient who has identified you, or you have identified yourself to be the companion, you do not even leave the hospital at any point, whether to go to town or anywhere. Fortunately, our ward is secluded with a fence. There is even a grass area whereby the companion can even go there and bask in the sun. Even if the patient is able to go, they can go together. However, they are not supposed to leave the hospital. But for the PPEs, they usually have the surgical mask on. And at this point, I would also want to mention that we talk to them even about the signs and symptoms of the disease. And since we started that, we only have 2 of them who tested positive, and looking at it, it could be like they would have been infected anywhere else because the durations were not very far away from the time they came into the ward, which we could understand because maybe these are patients they had stayed with for some time before they came to the hospital. So it is working for the patient. Thank you.
Thank you very much, Madam Margaret, and thank you very much, Madam Halima. This is really exciting, and we could have gone on and on and on. Reading from the charts, it's an excellent presentation from the panelists. Good presentation, good presentation. So thank you very much for taking time to prepare and share with us and educate us. And again, thank you very much, organizers, for keeping this going for 1 year. It is really, really going to transform our lives. And I would like at this point to hand over to Rashid. Thank you for being with us and God bless you. Rashid.
Thank you so much, and thank you everyone for joining us today. So my role is just to share with us how to claim your CPD points and to acknowledge that actually we've been really having a great challenge with the Nursing Council of Kenya in terms of getting the CPD points, but it's something that is being worked on. So how you go about it to claim your points, if you look at the chat section, I've put the procedure there, but we'll also attach to the email. So you log into your NCK account via the online services portal.nckenya.com, go to the log on to the courses, click on live events, enter the secret code that has been shared, that is S capital K 9 small
Rashid, I think we need you more audible. Get closer to the mic.
Thank you. You hear me now? Hello?
It is
Yes,
better.
it's okay.
It is better. It is better.
Okay, thank you. So probably I just ran over it once again, and I was just giving the stepwise move to get your CPD points. So you log into your NCK account via the osp.nckenya.com as it's being shared on the screen. Then click on the log on to the courses, click on live events, enter the secret code that has been provided in the chat, validate and submit. The secret code is capital S, capital K, 9, small I. Then you submit. This is also in the chat section. Thank you so much, Madam Margaret. Back to you.
All right. Thank you very much, Rashid, for that. And that just takes us to our time. And at this point, I would like to hand over to Dr. Miriam Wagoro. Asanteni.
Thank you so much, our esteemed. We are privileged to have you this evening. We want to thank you all for your support. We have learned a lot. The issue of companion is very, very new. Probably we can be looking into how fast people who have their companions recover. That could be a research question for us. I noticed that we have multi-professionals. We thank you so much. I recognize the presence of the chair of KMA from Machakos. And all of us who are there, even if we don't call you by name, please feel that you have been appreciated. We can see Professor Omoni. Thank you so much for attending. We hope to see you again. And Thursday after next Thursday. Thank you so much. Have a blessed evening. We had very wonderful presenters and the moderator. Bye-bye.
Bye.
Bye.
Goodbye.
Bye-bye.
Goodbye, everybody.
Bye.
Bye, everyone. Thank you.